Total drama has been highly requested on this channel, so today we're going to be breaking down the crazy medical type situations and injuries from the episode One Flew Over the Cuckoos. I've never seen this show, but evidently it's a spoof on survival reality TV. I was told to think Survivor meets animation. But before we get into it, if you are new to my channel, welcome. My name is Dr. Jordan Wagner. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
Morning, competitors! Or should I say, doctors!
Ah, sweet. Imagine you get like shot up with your guard to start your day. Obviously, we use a stethoscope. Even nurses use stethoscopes, but we don't use the head piece, which is a type of mirror to reflect the light.
Ready for today's big challenge?
Some of us are more ready than others. You made your choice, I made mine.
Oh my gosh. So sometimes residencies like that, where you actually have like a group of residents rounding together. The head doctor will ask questions and it's kind of competitive against each other.
Today's reward challenge is called visiting hours.
In the ERs I work, there aren't really that many rules relating to visiting hours. Heavy into the pandemic, yes, pretty much people were not allowed to visit because you just don't know.
These tanks contain the dismembered parts of two identical cadavers.
We don't just take bodies and dissect them. They're actually given to different universities to be used to learn every single muscle attachment, tendon, ligament, nerve, and understanding where they are on the body. It's crazy.
Each player will climb their respective team ladder, strap on the bungee cord, and jump into the tank with hopes of retrieving a body part. First team to bring a Frank and Chris to life.
Nice, cool.
Goes to the team who can tell me how to treat someone
Awesome.
with a bean stuck up their nose.
At home, if you have a family member that you trust, whatever nostril the bean is stuck in, hold the other one shut, and then somebody that you know blows air as hard as they can into the mouth. The air only has one place to go, and hopefully it has enough force to get the bean out. But if you can't get it out that way, then what you can do is go to the emergency department.
Ooh! Administer 2 cc's of pain meds and probe the affected area with a sterile swab.
No, just get in there. We actually don't start injecting things and putting different numbing agents in there. The sterile swab essentially is going to push it back versus trying to get around it and trying to pull it. Oh!
What the heck was that?
What is this? An electric eel?
Not to mention the electric eels. 3 zaps and you're out.
Nice. An electric eel causes shock, have up to like 600 volts. But what could happen, it could incapacitate you, especially if you're in the water, and then you could potentially drown because you're knocked out for a little bit and it can kill you that way.
Next question. Your patient has an itchy red inflammation on their butt. Diagnosis?
Diaper rash.
Nice. I like these questions. So diaper rash, we should be doing a better job of keeping the bottoms and the groins of people wearing diapers dry as possible. So if there is a wet diaper, that person should get out of the wet diaper sooner than later because you can get a diaper rash, which is a type of fungal infection.
Apply salve repeatedly to achieve humectant dispersion.
Yes.
Typical treatment of it, antifungal creams, ointments, or even powders, and keeping the area dry.
Your patient's got a white tongue, red eyes, and they're oozing gooey crud.
That's gross.
Pinkish iacus. Treat with 2 rounds of flopperty gibbets.
I don't know what flobberty gibbets is, just erythromycin.
Around with some of the terms in the textbook.
Conjunctivitis can give you red eyes, which then increases tearing, which then you can get the crustiness of your eye. Most common viral conjunctivitis, aka pink eye, treated easily with an antibiotic ointment.
Awesome. Don't let it touch my hair.
Another leg. Nice.
Nice work.
Oh, get out of there, kid.
Oh, come on.
Smells like earwax?
Pineapple-itis.
Pineapple-itis. Earwax is cerumen. I don't know, does earwax actually have a smell? Certain things a physician can smell, which gives us an idea of like a medical problem that could be happening.
Fur between the toes?
Stick 2 horse feathers up the whiz bang.
But fur between the toes, abnormal hair growth patches typically between the toes, not so much. The stuff that we deal with between the toes ends up being athlete's foot, so another fungus infection. Could be like cellulitis or basically other types of infections. So those are the things to think about with toes.
The gaffers have their cadaver. Time to start yanking some chain and be quick about it because the grips are right behind you.
Ah, it's so exciting, I can't
Oh my gosh, it just bit his arms. I've actually had cases where people bit somebody else's ear off. One that's disgusting, horrible. A human's mouth is super dirty, so you gotta get antibiotics. And when we actually get into fist fights, which we shouldn't, you always gotta worry about punching somebody in the mouth and hitting their teeth and then actually lacerating your knuckles, because then it can go into your joint. So we try to give you antibiotics before the infection starts.
Ew, what's this icky sore? Oh, and you're burning up, just like my passionate soul.
Gross.
Lemony.
Hold on. Red sores, fever, lemony burps. Aren't those symptoms of one of the diseases in the book?
Page 753.
What?
Mortistical Crumples disease. And it's fatal.
Lemony burps, fever, and a rash is just a huge broad differential that it could be. You're not going to jump to the conclusion that it's actually fatal. Most human beings don't follow exactly what a textbook definition of a medical problem. So you always have to think of a broad differential diagnosis.
It's highly contagious.
Okay.
Contagious.
See ya. Wouldn't want to be ya. There's more to this disease than either team knows.
Obviously, there's no such thing as a mortistical crumbles disease. I wonder what actually it is.
Quarantine Owen. Stat.
Get inside before you kill us all.
So then the question ends up being, do we just say we've all been exposed and it's over versus quarantine somebody further and try to hope that we didn't get as much exposure even though he's got full-fledged disease process. It also depends on how this highly contagious disease spreads. So if somebody's actually saying it's highly contagious, that's most likely means it's airborne.
Let me out of this crazy.
You know, it reminds me of those like bubble things that you can get in and bounce around with your buddies.
Great. Now Owen's not only infectious, he's a deranged pinball of death.
He's deranged, so the question is he's having encephalopathy versus meningitis, so he's actually getting the infection of the brain. Both can cause you to be altered and confused, not understand the current situation.
Symptoms of mortistical Crumples disease include explosive diarrhea.
Oh no!
Oh no.
A lot of people will experience abdominal pain, cramping, and actually almost nearly pass out because of the pain and the pressure within the abdomen. If you have too much pressure, you can actually push on the inferior vena cava, which decreases blood flow back to your body, which then can make you a little hypotensive, dizzy, and pass out.
Sudden hot
Oh, no.
flashes.
The hot flashes, as your intestines are actually moving and peristalsing, it can increase pressures and you get pain and you can sweat.
And temporary blindness. Anyone? Anyone? Well, that's a relief. Ugh, I'm blind!
And what about blindness? Okay, that didn't make sense.
Have you noticed we're the only ones who didn't study all night and we're the only ones who haven't been infected?
There is medical student disease. You are studying so much that you actually think that you have the disease, or you're in so much fear that you're going to get the disease. Maybe that's what they're leading to here.
No one's faking being sick.
No, but it's still a hoax. I just went to Chef's Kitchen where I found this cheese.
Gee, what's in that canister I've never seen before? Parmesan?
No, itching powder and laxatives.
Oh, that's messed up.
How could he?
Itching powder and a laxative. I wish laxatives actually made you go as quickly as these people are going here in this animation. There are stool softeners, there are laxatives, there are motility agents, there are bulking agents, there are all different types of ways to mess with your gut.
But wait, what about the sores on Owen and DJ?
It's just a
Oh.
slice of pepperoni. He needs to shower.
There are times that I've found food in weird places on human beings that it shouldn't have been there. Sometimes we find just weird things in weird places. But this was funny. I'd never seen this before. This episode was really interesting. I love the anatomy components, and I'm all excited about like the quiz game part of it. Real diagnoses and some actually just made up stuff. I really like this total drama. I want to see more. As I said, I've never seen it before. If you guys like me reacting to this video, check out this one. I know you're gonna like it. And as always, make sure you subscribe, turn your bell notifications on, like all the videos. Thank you so much for watching, and stay healthy, my friends.